Good morning. This is Steve Stites, Chief Medical Officer at the University of Kansas Health System. I'm here with you this morning with Dr. Dana Hawkinson, Hawkeye, I know I say it every day, Medical Director of Infectious Disease, and wanted to welcome all of our listening audience this morning. We have three special guests. Heather Harris, who's the Medical Director of the Hayes Med Campus for the University of Kansas Health System, Christian Whittington, a family medicine physician on our Pawnee Valley campus, and Mark Van Noorden, a family medicine physician on our Great Bend campus. All are members of the University of Kansas Health System, and we have a rural slant this morning because we wanted to make sure we're covering some of the issues out in central and western Kansas. But before we talk about that, first, Dana,
Hi.
How are you doing this morning?
I'm good. You sound good.
I'm good.
You know what?
I got a little sleep.
I think people are listening to you.
That's a mistake. No,
I think they're picking out.
That's more than what I can say for my kids. Are my children out there listening? Do you actually listen to me?
Wash your hands.
Yeah,
I think they're
Wash
picking
your
out
hands.
what they want to hear, though. But we'll keep the message going. But I was referred to as Dr. Hawkeye yesterday in the store. So
Awesome.
let's hope that the people are hearing the good message of washing your hands and staying home. Today, our numbers in the hospital, we have 34 inpatients, 13 in the ICU. 9 of those are on ventilators. But again, we have had people who have recovered from this. And this, again, doesn't include the people that we have discharged. So I think, that's tempered good news, but that's where we're at today.
It is, and it does feel like our numbers, and those are the numbers. We work on our CMO call across Kansas City and of chief medical officers, and it feels like the numbers, they may be drifting up a little, but it's certainly not the exponential rise. Again, it's too early to know exactly where we are on what curve, but eternal optimist here, I'm going to say that we've flattened the curve a little, and I think the stay-at-home, social distancing thing has worked and is working, so that's good news. I want to turn out to Heather Harris and Christian Whittington and Mark Van Noorden and just hear a little bit about from them what's going on out there in central and western Kansas. How are things? How is COVID preparation and the cases you may have seen? Heather, how are things at Hayes?
Good morning.
Good morning.
Yeah, we're doing well. We're on a little bit of a later curve than you guys out there in Kansas City. Ellis County, as an outpatient, we have 4 positives, but our service area, which encompasses 21 counties, has 13 positives so far. And then we currently are treating 2 positive patients here at Hayes Medical Center. They're in a unit all by themselves that we've created, which is similar to an ICU unit. Luckily, none of them have been ventilated. Both of them arrived for respiratory symptoms. We have we have lots of access for folks to get care if they need it. There's a hotline through the hospital. We're up and running on telehealth for almost all of the clinics, and then we're still seeing patients in the clinics. We want to make sure that everyone is getting the care that they need and not avoiding other health concerns that may be coming during this time. So we're really encouraging all patients to reach out to all of their providers, and we'll sort out what's the best way for them to be seen. But technology has been on our side so far, so we're getting to be able to get people seen. We're doing kind of the same thing. There's no visitors at the hospital except for special circumstances. You're going to see staff wearing masks to protect the patient. Cafeterias, grab and go. So you're going to see a few changes here at the hospital, but all to kind of help protect patients and staff to stay healthy.
Excellent, and you make a good point. Don't let yourself get sick by being afraid to get sick. And in other words, make sure you take care of your chronic medical problems or your baseline medical issues and not avoid doing that in order to not get COVID, because that could be a real detriment. Christian, on the Pawnee Valley campus, what challenges are you all facing and what things are going on?
We've been doing pretty good at Pawnee Valley. Good morning to everyone. Currently, Pawnee Valley and Pawnee County are fortunate in that we have no active cases right now. Most of our structure has been focused around preparation. We have created a respiratory bay off of our ER. Through the generous contribution of a local contractor, we've also increased our negative pressure rooms by 2. We're doing really well, following most of the same protocols from Hayes Med that Heather talked about. We are wearing masks and checking temperatures for every person entering the hospital with employees. Telemedicine is up and running in Pawnee Valley, and we are prepared to take care of the community.
Excellent. And Mark, how about Great Bend? Mark, hello?
Sorry, I had to unmute myself.
No, that's all right. My kids, again, I've referenced my kids once before. I think they would like me to mute myself more often, but yeah.
There you go. I would describe things in Great Bend as right now being pretty subdued. We've had 5 positives so far. I think we have treated 1 patient in the hospital who had COVID-19 and ended up being transferred out. But right now we don't have anybody inpatient who has COVID-19 or who is suspected to have COVID-19. It's an interesting time. Our convenient care and ER volumes are down probably by half or more. Inpatient volumes are down. I think people are just staying home, which is good. It's kind of like the calm before the storm, but we're hoping that the storm never comes.
Yes.
Like everybody else, we're preparing for the worst. We have established what I call a COVID clinic where anyone that could have symptoms is funneled to one location to be screened to see if they need to be tested or who needs to be self-quarantined. The whole idea being to keep potentially sick out of our clinics and protecting other patients and protecting staff. And it could also help to offload the ER if things do get crazy. We're working hard, like everyone else, to keep the possibly sick from the otherwise well by screening people at the doors, like everyone else is, and we're moving towards being active on telemedicine as well. So right now it's quiet, to use a few words that no one likes, and we hope it stays that way.
Yeah, you know what? Wouldn't that be the best outcome? So at KU, we've had 92 different COVID patients, 51 discharges, 8 deaths so far from our hospitalized patients. But again, I think our numbers are kind of hanging in that high 20, low 30s, low to mid 30 range, and go up and down a little, kind of on a daily basis. And we're hoping that the sheltering in place has truly bent the curve. So let's open our lines up for questions and see what questions the folks have that are out there.
Hi, this is Nate from the health system.
Good morning, Nate.
Good morning. I have somebody submitted a question, or rather, they wanted to see if we could speak to the theory that maybe COVID-19 was in our community last winter. I guess there's been chatter about that, and then they are also asking if you've had a spike in difficult to manage cases that you now suspect were actually COVID positive.
Yeah, those are both great questions.
Yeah.
And Nate, I have a question here from the health system. Some of the people that I work with want to know what you look like. So we got to get a picture of you and show our audience what Nate looks like sometime.
We can do that.
We got to do that. Otherwise, right now, you're just a voice.
We'll do that.
Okay, Dana, you want to take the first crack? Did we know cases maybe have some last winter are difficult to manage that have surprised us?
You know, this is a great question. I got this. I get this regularly. It's really hard to know. Certainly, there's been no published evidence or description of novel coronavirus in the United States last winter in December, prior to those first cases in Washington and New York. I think there was probably a couple really bad cold viruses. I had one.
Well, and influenza was bad this year.
Influenza.
And we had a higher mortality rate with influenza this year
Right.
than we traditionally do.
I've been contacted by other people who had said I was in the hospital for something really bad in January, like December. They didn't know what I had. I find that hard to believe, just with the ferocity of this virus, how hyper contagious it is. If our healthcare workers were taking care of you and you were critically ill and you were getting breathing treatments and doing aerosol generating procedures, I would have suspected that a lot of those healthcare workers would have been ill with that. Again, we don't think the virus has mutated or changed that much from the original isolate in China. But again, we don't have any documented evidence of that. I know that has been questioned before. I would say at this point, no. Now, we always hear stories of U.S. investigating things of that nature, but just from what we know about the disease and how it strikes so quickly in so many people, as it is right now, I find that hard to believe. And it was probably some other really bad, just common cough and cold virus. But
Well,
we'll wait.
in all honesty, as a pulmonary critical care guy, I would say every year we go through these periods where we find stuff we don't know what caused what, and so it would be difficult to ascribe to coronavirus this winter and not, well, what about last winter or the winter before that, or frankly the fall before that or the summer before that. I mean, you can go back. But we always have diseases we don't really understand and infectious processes we don't fully understand, and I don't think we can blame all that on the novel coronavirus.
Right.
So, yeah, but it's a great question, and
absolutely.
we do think, when was the first one? But it is awfully easy to spread. Like you say, if we'd had a case, I think we would have had a lot more cases, and that's not what happened.
And because we have healthcare workers of all ages, from the young to the older who are
like
more
me.
at risk of severe.
Yeah, thanks for that.
Well, I mean,
yeah, it is what it is.
You're
isn't it?
43, you're not that old yet.
Yeah, 43. You're very nice.
But that's
which one of us is younger?
That's a great question. So,
Okay.
yeah.
All right, next question.
This is Cher from Fox 4. Good morning, everyone.
Good morning.
I have a reporter that just sent me some questions she wanted me to ask you.
You bet.
It's kind of a three-part question. She wanted me to ask, what do you think about Mayor Lucas's extended stay order till May 15th? Do you consider that long enough? And what would it take for all of you to be comfortable letting that stay-at-home order expire?
Wow. Okay. So Dana and I are looking at each other. Who's going to take on the political thing? Here's the deal. And I think we can speak safely to the medical aspects of this. As a healthcare provider, what will save the most lives? And the answer is what we've been saying. It's shelter at home, 6 feet away, wash your hands, don't touch your face, cough into your elbow. Wear a mask now and in the grocery stores in public and things like that. Those are the things that will keep folks alive and healthy the most. Now, against that, you have to balance the terrible toll on our economy and know that I've been going to the same cleaners for 25 years, and they do a great job, and they're closing their doors next week. And the reason is that they're struggling. Rainy day books. I'm a rainy day books guy.
Great.
GoFundMe to try and help because of the cost without customers. I mean, there is a real toll on society, and I think whether it's Mayor Lucas or Governor Kelly or Governor Parsons or whoever, people are trying to weigh the calculus of the disease and the toll from the disease directly from COVID-19 versus the toll of the disease to our economic health. I don't know that calculus necessarily. I hold opinions as a private citizen. But as a healthcare worker here at the University of Kansas Health System, what I can say is the more you can stay at home, the more you can maintain 6 feet of distance, the more you do those things, the healthier you will be. And so as far as extending a stay-at-home order, from a healthcare perspective, that's great. From an economic, social health perspective, that's a whole different question.
Yeah.
And then I'm going to ask you a question. I just want to follow up on that a little bit.
Yeah.
Is it more important to shelter at home or to stay 6 feet apart? What's really the key there? That's me putting him on the spot, everybody. You don't know anybody. He just looked at me like, I can't believe you just asked me that.
I think as long as you're not in mass gathering areas like churches, congregations, restaurants where it can spread so easily, I think staying 6 feet apart is more important.
I do too.
I think using the hand hygiene, and most of all, and this is for our essential workers who are out there working right now, our mail carriers, our cashiers at the grocery store. It is so important, even if you're not 6 feet away or you have the sneeze guard in front of you, you are still interacting with customers in one way or another. You're touching the products that they're bringing to the cash register. Please just don't touch your face. Use the alcohol gel that's there. And I think the 6 feet away and the not touching your face are most vitally important for that type of thing.
Hey, out there on the line, they're listening on. Is there someone out there that sounds like they have a cache of coins crashing about every 10 seconds?
The casino.
It's like a casino. Can somebody maybe mute that line to see if we can, because it's pretty loud.
And
still pretty loud. Sounds like a little waterfall.
And I would like to add, too, just to your point, Governor Kelly, Dr. Secretary Norman, and even Mayor Lucas on the Missouri side have really been out in front as far as public health and trying to keep everybody safe so that when we can go back, we don't have to pull back again, so that we can roll out the economy and make things better for everybody. And so
Yeah.
I think since day one, they have been doing the conservative job from the healthcare point of view.
And I would just add, I think that if you look at it, shelter in place was really designed to make sure you stayed 6 feet away because you couldn't go out in large public gatherings. And as folks think about reopening society, staying more than 6 feet away is critical. And the reason it's critical is it depends on how far you cough. If you think about an aerosolizable, which is a big fancy word, but really means how far when I cough do my germs go. 3 to 4 feet is really a long distance. 6 feet is a very good, safe distance. And so, if you can stay 6 feet away, that's really important. Shelter at home is important because it helps us prevent you from going in good crowds. But man, that 6 feet away is critical. So when we do reopen society and start thinking about some staged reopening, trying to maintain 6 foot of distance is really probably, that is just, I can't tell you how important that's going to be.
Yeah, absolutely. And people will bring up, well, there's been studies that show that it goes further. If you cough or sneeze, absolutely. We aren't saying that it doesn't. But the majority of these droplets are going to fall to the floor. We know that it's been brought up before. Well, what about it on the floor and carrying home in your shoes? Well, that would be consistent with what we're saying, and that these droplets fall to the ground. And so that continues to be absolutely consistent. And the 6 foot distance is exactly why. The majority of those large droplets with the virus in it are probably going to drop to the floor in that nature.
And if it goes further than that, the density goes down dramatically.
Absolutely.
We're not sure how much of it's virus and how much of it's viral particles at that point, because we know that the dynamics of droplets that you cough or sneeze or breathe out are such that they're fairly large. They're actually, well, they're not large, but they're large in a physiologic sense. So anyway, okay, next question. Did we answer your question?
Maybe
Yes, you did.
Okay,
Thank
great.
you.
Thanks.
Sorry, I was on mute.
No, that's all right. Next question. The waterfall ended. That's good.
Good morning. My name is Jackson. I'm with Cake News. I had a question for our 3 doctors that are here from Western and Central Kansas. We were just wondering if, in your guys' prep work, I know some of you have cases, some of you don't. Are there any shortfalls in, items that you need, whether it's PPE, ventilators, isolation rooms, stuff like that, some gear, that you could see causing a problem and handcuffing your staff, or have your preps kind of been able to mitigate that in case there is a spike?
Heather, let's start with you, and we'll then turn to Christian and Mark.
Yeah, excellent question. I think that we had the advantage of being on the back end of the wave of this virus, so we could see that there had been, shortages and needing for preparation. So our team began meeting, early March on preparing for this as a team, and then having the advantage of being part of the health system and working through their resources has been really helpful. So at this point, we have, I think, all the resources we need. We created an 11-bed, what we're calling a medical care unit, where we're putting the MCU patients. We were able to make all of those 11 rooms negative pressure rooms with the help of a local engineering company. But so because we had time to prepare, I feel like we are really doing well with all of our PPE. I think PAPRs, around the country, is something that we continue to be very careful with use. But in terms of N95 and surgical masks, I feel like we're doing really well with our supply.
Great. Christian?
Yeah, I agree with Heather. We have been able to have the time and ability to prepare for the outbreak as it's coming up, as we're on the back side of this curve. And working with the health system, they've done a great job of coordinating and supply resource management. So we're in pretty good shape right now with regard to infection control and PPE equipment. And I think we're as ready as we can get to face this challenge as it comes forward.
Okay. Mark, how about in Great Bend?
I will echo what's already been said. I think we have all that we need. We have had time to prepare. The health system has helped with our supply chain. And every Monday, Wednesday, Friday at our incident command meetings, I hear reports about PPE. And I think things are on the up and up.
Yeah, excellent. Yeah, I think it does. And I think the other thing is that even here in Kansas City, we feel more prepared. But I will also say it's all about where you are on a curve. And if the curve stays flattened, we're going to be fine. If we get up to 400 or 800 COVID patients here, which is still very possible, then that's a completely different story. And we'll have to see where we go. And we just don't know, and we won't know for another few weeks where we are on that curve. The University of Washington is predicting in Kansas and Missouri, but they're a couple days apart, but the peak is going to be around the end of this month or the first part of May. There's another model that suggests it's going to be the first part of June and be potentially a lot higher. And so we just don't know. And we all get frustrated about that, and we have a pretty healthy debate here on a daily basis of where we are on the curve. And those of us who are more optimistic say, hey, we're flattening the curve, things look better. And those who are a little more concerned about or perhaps look at the data a little differently will say, gosh, we're not really safe to say that yet. And I think our challenge is that both those statements are true. Mm-hmm. And then you have to figure out where we're going to end up. Yeah. Okay, next question.
This is Nate again. I have somebody asking about the status of COVID-19 testing in western Kansas.
All right. Heather, how is it there in Hayes?
Yeah, so, I can't test every resident. I have supplies to test hospitalized patients. We hope to have in the next week to 10 days an in-house machine that will be able to do two tests every hour. But we're waiting on, as everyone else is, all the supplies to be able for the machine to be up and running, which we'll use for only in-house or in-hospitalized patients. But currently we're testing outpatients who have symptoms, so we're still doing outpatient testing unlike Kansas City. And of course, testing anybody with respiratory symptoms. Because we were, up the curve, we could tell that testing was going to be a problem. So with the help of Quest and our laboratory, we've become extremely resourceful on how to make testing kits and split out VCM media with the help of the lab under sterile conditions, and then be a little creative on testing swabs. So we were able to expand our testing. So right now we're able to test those that need to be tested, but we're not at a level to test asymptomatic patients.
Yeah, pretty much I think the story. Christian, how about in Pawnee Valley?
We've been doing pretty good at Pawnee Valley. We share the same concerns Hayes does. Is that we are very limited in our testing kits and are currently focusing on sick patients, possibly hospitalized patients, and anybody with symptoms consistent with COVID, but we are nowhere near being able to test the asymptomatic patients at this time.
Yeah, and that's one of the struggle in infection control is to know what the real prevalence is. Mark and Great Bend?
Again, I would say the same. We are testing according to CDC guidelines and not testing any beyond that.
So I believe next week we'll have some of the folks from our testing center here at KU on our program so that you can hear directly from them. It's fascinating to look at the challenges that the lab faces because you think, well, this is pretty simple. They just need a test. And the test. And the struggle is that you have to have the right medium. You have to have the right kind of swab. You can run out of swabs. You can run out of medium. Then you try to make your own swabs. They don't test right. You got to confirm those swabs. There's a lot more science in this than I think most folks realize. It's not like just going to get another CBC. And that's the struggle. And so as a result, we've not been able to test everybody, which leads us to trying to estimate the prevalence, Dana, on the number of deaths or the number of inpatients that we have and trying to extrapolate that out to what is in the community. But we don't know if that's anywhere near right or not.
Right, especially when the fact that 80% or slightly over 80% of people will have minimal to no symptoms and won't even need to come to the hospital. So it's very difficult to estimate that prevalence overall.
Yep. Any other questions?
Oh, I have lots of questions.
Well, let's wait. Well, let's see. Any reporters out there in our media? Anybody else?
Yes, Becky Kaiser. I'm with Hayes Post and Eagle Radio at Hayes, and I have a question for all three of our smaller hospitals in Hayes, Great Bend, and at Pawnee Valley. You talked about the equipment and preparations that you've made. What about your staffing level? Being smaller hospitals, I assume you have fewer employees than the bigger hospitals. How are you handling that? Do you have enough people on your staff?
All right. Well, let's start. We'll go a different order this time just to mix it up. Christian?
Yeah, Pawnee Valley is probably the smallest hospital in the system. We have been doing very well. We have been actively cross-training all of our staff as decreased volumes in physical therapy, respiratory therapy, and the clinic. We are cross-training our staff to help with the emergency room and the acute care floor should that ramp up. Currently, we are doing very well. We have a couple open staff positions, but otherwise we're fully staffed.
How about Mark? How about Great Bend?
So we are also doing cross-training. The interesting thing with this situation is that because our OR is largely shut down and volumes of the places are low, we really have, to some degree, we're looking for places for people to get their time in, and that opens up opportunities for the cross-training, opens up opportunities for people to help where help is needed. So I think at this point, staffing is good. I think we're solid.
Heather?
Yeah, we've made some plans for a surge that has required some creativity, both with nursing staff and providers. Our current status is we have adequate staff, and like the other physicians mentioned, the OR is quiet, so we've moved some folks around, and we're also doing quite a bit of cross-training. Being the referral center for 21 counties, we're preparing for a larger census if need be, and so we've been pretty creative in some options to help with that if needed.
Yeah.
Dana, there's something you wanted to add, I think?
Yeah, absolutely. Having worked in Parsons and some other rural areas, and please correct me if I'm wrong, but in these smaller rural areas, the hospitals, the nursing homes, these other care facilities employ a lot of people in those areas. And so it would be very easy to be overwhelmed if one person is ill and spread it to other workers. And so certainly in those cases, continual education about proper donning and doffing of PPE, continual education about hand washing and hand hygiene and not touching your hands to your face to really prevent the spread, because it wouldn't take long for some of these facilities to be overrun and these communities to be overrun. And please correct me if I'm wrong, but we need to keep everyone safe, the patients and the workers there in those areas.
Yeah. And Heather, I suspect you would echo that.
Absolutely. Hayes Medical Center is the largest employer for Hayes. So, very important, which is why we're trying to be as safe as we can at these times. And I believe our community, I know you guys haven't been out here, obviously, because you can't, but not that you don't want to, but right now, but they've done a good job of staying home. You're seeing people out walking and enjoying the nicer weather, but there is a calmness, and people are taking this seriously. So hopefully we can all stay well and we don't have to have the surge plan in place.
And one of the interesting points, just from a public health perspective, a respirable pathogen moves from one to another, and a lot of that, one person to another, a lot of that's based on population density. Yeah. So if you're closer because of public mass transit or crowded schools or crowded streets or whatever, there's just a real significant factor related to that. Cross our fingers that maybe rural parts of our country that have as low density as parts of central western Kansas won't have the same surge as perhaps a more urban area is. And one of the problems is we don't have models for that because we've never really looked at this question like this from a pandemic perspective. So, all right, other questions from our media or even internally? Start with the media. Okay, Nate, you're up.
All right. I have some just kind of real general questions that people have been asking this morning. One person wants to know, what's the probability of the virus transferring through food, through that you would pick up and carry out?
You bet. So, Dana, I think that's pretty low. What are your thoughts?
I would agree. I think on the food itself, it's probably low. There's always questions about takeout and drive-through. Certainly on the bags or the containers, you can have contamination. I think on the food itself, for the most part, the guidance has been it's really pretty low. If you are doing takeout or delivery, you can take an overabundance of caution. Maybe leave the bag outside the door. If you bring things in the container, you can always change from the food from the container to your own plates.
You can wipe down the container. You can wear gloves.
Wipe down, yeah. And the final thing that you really want to do right before you eat is wash your hands and then pick up your silverware and start eating. But I think on the food itself, it's probably pretty low.
And just comment, just not to say that every chef on to-go food uses a lot of salt, but that's not really a very hospitable environment for the virus.
I think that's what it is. We have testing on surfaces. I think overall the environment, say on a hamburger or something like that, you're right, it is probably
the pH is not right, the salt content's not right, the oil isn't right. It actually isn't a great environment for a virus like this.
Yeah, and we don't have any direct evidence, but we know that this virus is pretty weak, meaning that soap and water is probably the best thing to destroy the virus, and other common household disinfectants are pretty are really active at destroying this virus. So in that sense, it's pretty weak as far as that goes.
Okay. Other questions?
Okay, just the last two, these kind of go together. If you do catch the virus, what is the best at-home advice to beat it? And do you think you can get reinfected with COVID-19?
Yeah, two great questions, and then we'll you and I can do some end-of-day comments here. So,
yeah, the best thing to do at home if you think you've caught the virus or have the illness, stay home. If you feel that you're getting worse, absolutely call your physician or call 911 or come to the emergency department. Just call ahead before you do. The best thing for home remedies is kind of the classic. Fever reducer such as Tylenol. A couple doses of ibuprofen is probably not going to hurt you. Rest and fluids and maintain your nutrition. Those are the best things to do. Can you get reinfected? That's one of the golden questions that we just don't have the answer to. We know that you can recover. Most people who recover will develop antibodies to this virus. Some people won't even develop antibodies, but they'll still recover. We don't know if those antibodies provide acute protection. We hope that they would, 3-6 months, a year down the road, but we don't know that for sure. So we are still looking into that, and that all plays into, well, can we get a vaccine? So those are questions that we still don't know the answer to. We hope that you would be protected in the short term, though.
And we know that in a close relative of SARS-CoV-2 was, because we're so imaginative and medical and how we name things, SARS-CoV-1, that virus, actually the antibody lasted for 2 to 3 years afterwards. So we can cross our fingers. Maybe we'll see that. We don't, but like you said, we don't really know yet on SARS-CoV-2. So as we wrap up today, any final thoughts from our guests from Western and Central Kansas? Heather, Christian, or Mark, final thoughts?
No, we appreciate being on today. And as everyone, we're just day by day and trying to do the best we can with the information that we have, and still encouraging people to get out and be healthy and exercise. Luckily for us, I've seen more bicycles and dogs on leashes in the last 2 weeks than I knew existed in Haines. That's good.
Christian or Mark, thoughts?
I think I would echo that with Heather. We are very fortunate with the tremendous community support, and our community's been doing a very good job at social distancing, and would encourage everybody to continue to do the same, and give us a call if you have any health concerns.
Mark?
I think I've said all I need to say. Thank you.
All right.
Thanks, everybody.
Dane, any other final thoughts today?
Yeah, final thoughts. I was talking with a couple of our lovely transporters today about them wearing masks, and I continue to stress them the most vital things you can do, and this is for people who are out in the grocery stores and out around wearing masks, is more important than the mask itself. Use good hand hygiene, alcohol sanitizer if you can, wash your hands with soap and water, and absolutely do not touch your face, because if you're manipulating your mask, the chance of you contaminating your face, getting into your eyes, your nose, your mouth with this virus are extremely high. So if you can remember, and it's hard, but don't touch your face when you're out in public or even at the hospital at working. Use good hand hygiene and maintain those practices.
I think that that is our story, and Our story will continue tomorrow with Jerry Moran and Dr. Lee Norman. Jerry Moran, obviously, the senator from the state of Kansas, and Lee Norman, KDHE secretary. And I think we'll probably have a lot of focus and questions about reopening and the Economic Recovery Act and things of that nature. As we look forward to that, I would remind us all that it's really not a reopening. It's a new opening. It's a world that we've not been in before since 1918. And COVID-19 is here. And as we think about venturing out into society, it'll be so important to still follow these new rules that we haven't had to follow in the past if we really want to stay healthy and if we really want to prevent another surge that could come on in June or July or whenever that may be. The world's going to be a little different. We can still make it great. And I know here in Kansas City, Kansas, Western Missouri, that's what we'll do because that's who we are. But for now, there's no place like home. Stay safe. We'll see you tomorrow.